Hi, my name is Jen, the RPN. Today I'm going to do the neurological assessment for Mr. T. Touch my hands and pull the curtain to maintain the privacy. Hi, Mr. T. Nice to meet you. My name is Jen, your nurse today. How are you today?
I'm good. Hello. How are you?
Good. Is it okay for me to do a physical assessment for you? And the information will be only shared within the healthcare team members.
Yes.
Thank you, Mr. T. Do you have any medical illness?
No.
Any medical history like a stroke, head injury, fall injury, spinal cord injury?
No.
Thank you, Mr. T. Are you taking any medications right now?
No.
Thank you. Do you have allergies?
No.
Do you smoke, drink alcohol, take street drugs?
No.
Thank you. Do you have any headache?
No.
Any dizziness, feeling room spinning?
No.
Have you ever had any seizure?
No.
Have you ever had any shaking or tremor on your face, hands, or any body part?
No.
Do you have a weakness in any body part?
No.
Do you have a problem in balance when you walk?
No.
Thank you. Do you have any numbness or tingling in any body part, feeling like a pins or needles?
No.
Thank you. Do you have any difficulty swallowing or speaking?
No.
Any environmental exposure like pesticide or lead?
No.
Thank you, Mr. T. Now I'm going to do the physical assessment on your nerve system. Mr. T, do you have any pain when you rest or doing your activity?
No.
Thank you. Are you taking any medications for pain?
No.
Thank you, Mr. T. So next, I'm going to do coma scale assessment. The first thing is eye opening. So when I approach Mr. T at the beginning, his eye open at my approach. So his eye opening is spontaneously, score 4 out of 4. Next, verbal response. Mr. T, would you please tell me your full name?
My name is John Thomas.
Thank you. What day is today and what is the year?
Today is December the 12th, 2020.
Thank you. Do you know where you are right now?
Yes, I'm at the clinic.
Thank you. So Mr. T had the verbal response orientated, score 5 out of 5. By assessing verbal response, I also assess level of consciousness. He is alert and orientated to place, person, and time. Next, I'm going to assess his motor response. Mr. T, do you mind to hold your thumb up? Good. Can you squeeze my 2 fingers? Thank you. So Mr. T had the normal motor response, score 6 out of 6, obey command. So his coma scale total score is 15. Next, I'm going to do the vital signs, including blood pressure, temperature, heart rate, respiratory rate, and oxygen saturation. But in this video, I will not do it. Next, I'm going to assess the pupil size. Mr. T, can you please look at me? I'm going to check your eyes. Thank you. So Mr. T had both pupil equal, symmetrical, and the size is 3 millimeter. The normal pupil size is 3 millimeter to 5 millimeter and decrease equally in response to the light. Next, I'm going to assess pupil react to the light. Mr. T, I'm going to shine the light from the side of your head to one eye quickly to the other eye. And then I'll repeat again. Thank you. So Mr. T had a normal react to the light, including direct right reflex. That means when I shine the light to one side of eye, the stimuli eyes constrict. This is normal direct right reflex. And he also had a normal consensual light reflex. When the light shines to the stimulated eye, the opposite eye had the constriction, and this is normal. Some people had a dilated eye or fixed eye, It's a normal finding related cranial nerve damage. Next, I'm going to assess the muscle. I'm going to assess the muscle on his face and then on his both arms and on both legs and both feet. So Mr. T had a normal face muscle equal in both sides and no drooping of the eyelid or no drooping at the angle of the mouth. And his both arms, legs and feet are bilaterally equal and in relative portion to each side. It's normal. He had no muscle spasm, no tremor, no shaking, no muscle contraction. Next, I'm going to assess muscle strength by assessing his limb movement. Mr. T, do you mind to hold up your both arms? Hold it strong and push against my resistance. Good. You can let go now. You might want to bring up your both arms and bend your elbows and then pulling against my resistance. Thank you. And then you want to move your both arms against my resistance. Good. Thank you. You may let go now. Now I'm going to do leg movement assessment. Would you please lift off your leg, one leg at one time, and against my resistance. Very good. Now the other leg. Very good. Now would you mind to push your feet down to the bed and like a pushing gas at a gas panel. Good. And then move your leg towards your head and against my head's resistance. Good. Okay, now I'm going to assess the coordination. Mr. T, look at my finger and use your index finger to touch my finger and touch your nose. Touch my finger, touch your nose. Touch my finger, touch your nose again. Very good. This is the coordination test, finger to nose test. He had normal and smooth finger to nose movement. This is normal. And if a person had a post-pointing or constant deviation to one side, it's lack of coordination. Now I'm going to do heel to shin test. Mr. T, would you please lift your right heel to the left knee and move down along the shin to the ankle and move back to the knee and down to the ankle. Thank you. Now we can do the other leg. Do the same thing. Move down to the ankle and back to the knee and down to the ankle. Thank you. You may let go now. Thank you. So, based on the above assessment, Mr. T is alert and oriented to place, person and the time. His coma scale is 15 and he had no pain at rest and activity. He had no pain medications. His eye opening is spontaneously. His verbal response is orientated. His motor response is full resistance with a full range of motion of both upper arm and the lower legs. It's normal. And he has normal coordination. Normally, the complete neurological assessment should include cranial nerve assessment, sensory assessment, and reflex assessment. Due to the time limitation, I will not be able to do this today in the video. This is the end of the assessment. Mr. T, do you have any question for the assessment?
No.
Thank you very much.
Thank you.
This is the end of the video. Thank you for watching.